Alright, I think everything's working. Alright, hi, my name is Matt Berenger. I'm a student occupational therapy assistant student at Rhodes State College. And today I'm going to talk to you about my EBP presentation for my 2130 class. So what we're going to talk to you today about is CIMT, which is constraint-induced movement therapy, and its effects on patients that suffer from a CVA. So what is CIMT? CIMT is constraint-induced movement therapy. It's a widely used approach used to improve the functionality of an affected limb or limb that has been weakened during a stroke or brain injury. The main focus of a CIMT is to decrease the patient's habits of not using the affected limb. CIMT revolves around a goal or task-driven approach to increase functional use and to improve the control of the affected limb. So a lot of times what can happen is a patient that suffers a CVA or a brain injury can lose function of a extremity, a limb, an arm, or hand. Instead of working towards trying to strengthen that, they will compensate for it and they will use the other hand, which will weaken the use of that affected hand. So what all is involved with the CIMT? Structured, repetitive practice with intensive therapy in the affected arm. So a lot of repetition, just forcing that hand to be used, that arm to be used, and then they pair that with the restraint of the non-affected hand. So that what it does is it limits that patient to not be able to compensate and use that unaffected hand to do the task. So application of functional techniques that transfer increased function from the clinical setting to the real world. For this project, I use a couple of different search methods. I use the Google Scholar search with the keyword of the CIMT, the article search for CIMT and CVAs within the OSU library website. Tons of different articles that popped up through there. A couple of them will be cited later in the project, and then two of the textbooks for this class as well too. So for my question, it's a pretty basic question, is would CIMT constraint-induced movement therapy excel over other treatments at treating a client suffering from a CVA? Basically, the question's kind of asking that is this therapy going to work better for a patient with a CVA than other methods? So following the PICO question there, the P for the patient-client groups, ideally, but it doesn't have to be, adults age 50 and older. With the CVA. For the intervention, obviously it's the CIMT, the constraint-induced movement therapy comparison. We're just comparing it to other common methods. And for the outcome, does the patient show increased function? So summary of my findings and the same findings that are resembled in the studies that we'll show here in a little bit. Short answer is yes. A patient suffering from a CVA can greatly benefit from the use of CIMT treatment sessions. Main factor that would lead me to be inclined to apply the CIMT is that if the patient has begun to compensate for their affected limb. So if the patient has started to compensate for it, it would be definitely a good way or a good treatment to involve here. And also if the patient looks like they may start to show signs of compensation, you can start to maybe head that off before it becomes an issue. So my first article here is a comparison of two constraint-induced movement therapies in chronic stroke patients. Summary of those findings was a group that practiced the CIMT. They met and treated more frequently and for a longer duration, which is what is required of the CIMT. They did show significant gains in the affected limbs. One of the limits of that study, there was a very small trial size for each study. So one of my recommendations for that would be a larger population in each group. And with that being the case, it was a culmination of of professionals over a randomized group, so I put that at a level 2. So my second article was a article by it was in a publication for, I forget which one, but the modified constraint-induced movement therapy for elderly clients with subacute stroke. So again, same thing with this. It was a small study with only 4 adults, and they had a mean age of 82, so it was an older group of adults. Summary of the findings: the study showed that the 4 elderly adults after a stroke were able to tolerate 2 hours of restraint wear on the unaffected upper extremity and intensive task-specific training for the affected upper extremity. Positive effects were reported for all 4. Again, limitations was a small group. There was only 4 subjects that completed the tasks. So recommendation for further study: continued study in a larger sample is necessary to determine whether elderly adults with stroke maintain the gains noted immediately or after a CIMT program. So my third article here was actually one of the best articles that I had found. It was a compilation of many different studies and trials regarding the CIMT therapy and a systematic review of controlled trials. So based on all the different results of the studies and stuff in here, the CIMT, when applicable, is beneficial to those patients that suffer a hemiparesis from the result of a CVA. Limitations for this study: this study was a compilation of many random trials, and I really couldn't find a limitation other than there were numerous clients that did not meet the criteria to be a part of the individual trials. So there were a lot of individuals that were cut from the trial because they didn't quite meet all of the qualifications. Recommendations: the study was well put together, and I did not have any recommendations for that study. With that being a review of multiple randomized trials, I do have that at a level 1. Here's my reference page, citing 3 of the 10 articles that we had, and also the use of 2 textbooks, looking up the articles there for the constraint therapy. So, and that's all I have. Thank you.